Great. Good morning, everybody, and thank you for your patience. Can we really urge people to come forward and get tested? To the 24 hours to 8 p.m. last night, we had 12,700 tests, but we did have 6 cases of community transmission. Now, 5 of those 6 are the household contacts of the man we identified yesterday. So 5 out of the 6 are the spouse and children of the house of the one case we had yesterday, and the 6th person is a very close contact of them in very close proximity. The cases are all very close to Berejiklian, and investigations are underway. We'll have the genomic testing this afternoon to confirm that they are part of that cluster. But it's really important to note that through households it's really easy to spread the virus, as we've seen. So in one household we've had 6 people get the virus, and what is really important is to make sure that, given we are towards the tail end of this particular outbreak, there haven't been other superseding events, we want to keep it that way. And that's why it's really, really important for all of us to come forward and get tested, especially if you live in and around those suburbs which Dr. Chant will talk about this morning. But I can't stress enough the importance of people coming forward and getting tested. All of us want to see those restrictions we have in place eased. All of us want to be confident we can go back to what we had before Christmas, and that will only be possible if we get those high rates of testing to give our contact tracers, to give our health experts the confidence that we are on top of any unknown strains of the virus. Again, this demonstrates why we have those rules in place regarding households. Imagine if that household, there's a number of people in that household, imagine if they'd welcomed a number of people into their household, what would have happened? And I think this identifies why the health experts give us the advice they do. And whilst every case is concerning, it's not unsurprising. But having said that, it just demonstrates how all of us have to be on our toes. All of us have to remain vigilant, especially if you live in those suburbs which Dr. Chant is about to talk about. They are all in and around Berejiklian in that cluster, and it's really important, especially in that community, for people to come forward and get tested. Even if you've been tested before and been negative, it doesn't mean you're still negative. So please make sure you come forward and get tested if you have the mildest of symptoms, and follow the health advice.
So New South Wales recorded 6 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night. All 6 cases are close contacts of the Western Sydney case reported yesterday. So this brings the total to 4,877. There were 12,764 tests reported to 8 p.m. last night, and that's a decline on testing levels. It is critical that we get those testing rates up very high so that we can detect these unrecognised chains of transmission. And the areas that I'm particularly calling out for testing are in Bankstown, Lidcombe, Auburn, Berejiklian and Wentworthville. So my plea applies to everyone across the state, but particularly in those local government areas as we're trying to mop up any last chains of transmission. Can I also say, extend my appreciation to the cases that we've notified over the last couple of days. We understood and have identified this household transmission and these cases because of the actions of those individuals. They responded to calls for coming out for testing, and they are the true heroes, because you can see by recognising the chains of transmission, by testing around those cases, we've identified further cases and been able to stop any further spread into the community. So I extend my greatest appreciation for your cooperation. So of those 6 locally acquired cases, all are close contacts of the Western Sydney case reported yesterday. The investigations into the source are continuing, so we don't know the exact link to their source. We are waiting for genome sequencing, which will be available later today. That will give us some insights into terms of what genomic linkage is, whether it's Berejiklian or Avalon, or keeping our options open, but they would be obviously what we would be considering. One of these members is a worker at Concord Repatriation General Hospital, and they're now in isolation, but did work some shifts whilst in the cardiology and radiology wards whilst potentially infectious on the 12th, 13th and 14th of January. But the person's role involves minimal patient contact, and they also wore a face mask during each of their shifts. So it is pleasing to say that the 7 close contacts, their workplace contacts have already been tested and tested negative, obviously they will then be placed in 14 days quarantine, and we will ensure that they're tested repeatedly and will update you on any further cases. There's also a number of staff that have been identified as casual contacts, and they're being followed up by the Public Health Unit. And as I said, investigations are ongoing, but there is no ongoing risk to patients or staff. Close contacts have been identified and are isolating. Routine testing is being undertaken, and the environments in which the person worked have been effectively cleaned. So just want to reassure people that please continue to access care from Concord. There is no ongoing risk to patients or staff there. Also last night we issued a number of alerts relating to new venues and some train services. So again, I urge the public to keep up to date on the New South Wales Government website. But anyone who went to the Wentworthville Medical and Dental Clinic at 122 to 128 Station Street, Wentworthville, and who was in the dental, physio and imaging waiting room, I believe that's a shared waiting room, on Friday the 15th of January between 11:30am and 1:15pm is a close contact who must immediately get tested and self-isolate for 14 days regardless of the result. And people in other areas of the clinic at that time should monitor for symptoms and immediately isolate and get tested if they appear. And then anyone who was at the Auburn Centrelink at 5 to 9 Macquarie Road, Auburn, on Thursday the 14th of January between 3pm and 4:15pm should also monitor for symptoms, and if they appear, immediately get tested and isolate until a negative result is received. We've also had a positive sewage detection in Glenfield. We are aware that there is some cases in that catchment, but as a precaution, we really are again urging the population to come out in those suburbs of the treatment plant in Glenfield. So that catchment takes in a very broad catchment from suburbs like Ayres, Amberville, Appin, Campbelltown, Casula, Ingleburn, Minto, Raby, Roos, just to name a few. So please go onto our website, and if you are in that catchment, again, the most minimal of symptoms, please come out and get tested. Thank you.
The repatriation hospital, Dr. Chant, I believe venue for that hospital. Can you explain the reasoning behind why you don't need a venue for that hospital?
Because we basically work through, we have a lot of processes in hospital. We know which staff work on particular shifts. We interview. So the process that we go through when we have a case in a healthcare worker is that we interview the case, determine when they were onset of symptoms. We also do an intensive healthcare worker interview to look at all of their practices, behaviours, who they've interacted with. We can immediately identify those contacts. We've advised staff at Concord facility about that in a memo that was issued last night, and we'll continue to work through the identification of any close or casual contacts.
Premier, can I ask you? You've suggested that the reducing of restrictions relies on increased testing rates, but overnight we've seen, I believe, the lowest testing numbers in about a month. People in New South Wales doing themselves out of an easier time by not coming forward for testing?
Firstly, can I thank everybody who has come forward and got tested. I mean, if you look at the last few weeks, the testing rates on average have been outstanding. And I guess when you start having days where there's 0 case numbers or 1 or 2, people start getting a bit complacent. We ask people not to be complacent. If you have the mildest of symptoms, please come forward. Just to put things into perspective, the Crossroads outbreak that we had took us 4 months to quash. Now, we're only a month after the initial outbreak that we had just before Christmas. We're doing really well. But our ability to go back to more normal lifestyle, our ability to ease some of the restriction does rely on people coming out and getting tested, because that gives us confidence that there aren't strains of transmission out there that we don't know about. It also gives us confidence that all the close contacts and casual contacts have been tested and aren't unintentionally spreading the disease. And so it's really important for all of us not to be complacent. Just because you have a couple of days of 0 or 1 doesn't mean you've completely quashed the outbreak. outbreak, it means you have to stay vigilant. We are, as Dr. Chant said, at the tail end of dealing with the outbreak, so now you'll see most of the cases coming through community transmission are household cases. However, it only takes one case where someone doesn't know they're infectious to cause another super spreading event, and then we're back to where we were before Christmas. We don't want to be in that situation. So can I stress how grateful we are that people have come forward and got tested in droves, especially the community around the Berejiklian cluster. I mean, it's been outstanding, but we really need to up the ante. So as Dr. Chant said, if you live in any of those local government areas that were announced today, if you live around Glenfield as well, where there was some detection in the sewerage, please make sure you come forward and get tested with the mildest of symptoms. But that applies to all of us across the state, because you may unintentionally have come into contact with someone who lives in those communities, or work with someone, or gone to the same venue or social event. So just because you don't live in those areas, or just because you don't live in those suburbs, doesn't mean we can be more relaxed. Quite the opposite. It means we have to be on our toes.
In a similar vein, we saw protests yesterday against the wearing of masks. Could this potentially backfire on those people, and those sort of rulings won't be wound back while there's people out and about intentionally doing the wrong thing?
Obviously, when we don't have people respecting the health advice, it does create a higher risk of the virus transmitting, and none of us want to see that. And we just ask people to be respectful, and please know, and I've said this on many occasions, the New South Wales government won't impose a restriction a day longer than we need to, but our ability to ease restrictions does rely on the science and the health advice, and we need to make sure we do it at the right time. We're still confident that if testing rates stay high, that the health advice will give us that confidence to make those changes, but it does rely on more people coming forward to get tested.
Last week you spoke about being pleased that our international arrival intake's been halved. Now that Emirates cut flights, do you still think that it's a good way forward for the next month?
What that shows or demonstrates is how careful we need to be when making those decisions. I hope that's a temporary situation and that resumes, and different organisations will make different decisions. But I think that demonstrates the challenges you have in managing overseas arrivals. We want to encourage as many Australians back home as possible. We want to encourage as many flights continuing as possible, because they bring in precious cargo, in addition to human cargo, obviously freight. But also, during and post-COVID, we want to make sure we're in a strong position to be able to resume those flights, especially as the vaccine is rolled out, especially as many nations are now turning their attention to post-COVID. We need to be really open to that. I think the pause between January 15 and February 15 is important in relation to the number of Australians coming back home. That gives us time to look at what the new strains are doing, gives us time to plan forward and determine what the ongoing policy settings should be.
Premier Andrews of Victoria has hinted that there could be a relaxing of restrictions for people entering Victoria from New South Wales. Has he let you into his thinking there, or have your health minister spoken about that?
No, he's not been in touch with me at all. But I'd also say that should have occurred quite a while back, because we don't have a hotspot in New South Wales. We are, of course, dealing with the result of an outbreak we had from a month ago, but I think everybody would agree that closing a border of such significance is a really big deal. And I stress that we waited till Victoria had in excess of 100, I think it was 180 cases they had the day after we announced the border closure. So just to put things into perspective, those decisions are difficult ones. They affect a lot of people, and I would just ask people to really think about those decisions before they're taken.
Maybe something to address, but given hotel quarantines where we see most of our cases, and given what's happening in Victoria at the moment with and South Australia with Victoria with the tennis players, why was it deemed sensible for security guards in the quarantine hotels not to be wearing masks?
Look, I can't answer that question. Dr. Chant and the team get advice from those bodies. Do you mind asking? Yes, thank you.
So I think it goes to the location in specific places, the security guards. The Clinical Excellence Commission provided that advice. That's been updated, taking into account the fact of the new concerns around variants of concern and the increased transmissibility. So I can reassure the community that the security guards will be wearing masks at all times in quarantine facilities.
It was deemed sensible for the rest of us to wear masks in indoor spaces finally, even when we're not really close to each other, but you're in a closed environment hotel. Wouldn't it have made more sense to...
I think I might have to go back to the specific guidance, which I haven't personally viewed, but the concept, I think, would have been based on where they were located or their contact, and if they had any thought of having any contact or any proximity, then they would have been required to wear a mask. But I'll certainly follow that up. But I can reassure you that that advice has been updated and was immediately implemented, particularly in light of the increasing concerns around the transmissibility of the variants of concern.
How confident then are you that we're at the safest point? The measures in place now are the best they can be?
We've put in a lot of different measures and we're scaling those measures. So we have now got surveillance testing of our staff that are working in quarantine facilities, and we're looking at the end-to-end chain of people arriving at the airport right through the process. We also have implemented quarantining and mandatory testing of flight crew that are coming in, again to give us greater intelligence about any infectious flight crew that may have been here. We are increasing the auditing of our hotels to ensure compliance with all the policies and procedures, and we're also making sure that we work and learn any lessons from both South Australia or Queensland that comes out of quarantine breaches. I think that it's clear that we've had to continue to learn, adopt new measures and implement them, but that ongoing high levels of compliance is going to require quite a lot of high auditing to make sure, because with these increasingly transmissible strains, even a minor breach at any point in time, and we've got to remember that our system is a very human one, is going to pose a risk to us. So we have to do the best we can, and I would like to thank all of the workers in that program for their diligence, but we need to remain at a high level of vigilance and compliance, and that's going to be one of the key challenges moving forward.
Dr. Chant, do you have any idea of the index case in this latest small cluster of 7 people in Berala but not linked to that cluster?
Yes, we are investigating, and we've had a number of possible leads that are being investigated, but at this stage no firm connection. So as you're aware, we like to have a clear line of a person transmitting to another person, to call it linked. The genomic sequencing will allow us to determine whether it's genomically linked to which cluster, but at this stage we don't have a definitive person-to-person explanation of how that transmission got into that grouping.
You still don't know that it is genomically linked to the Berala BWS, do you?
No, not at all. We will. That's why we've urgently, and again, thank very much the laboratories for doing that testing. It does take about 24 to 48 hours to get that genome sequencing back. We're advised that those results will be available later today. That together with the ongoing upstream investigations where we look at where people could have been exposed. We've also performed a lot of other tests over the weekend, and again, thank you for the cooperation of the participants who have allowed us to do some other tests like serology, which sometimes helps us identify when people were infected. And so putting all of those pieces together will allow us to do that thorough investigation, but we're certainly very keen to see if we can establish any links.
In recent days, Dr. Chant, you and the Premier have both been quite consistent in raising concerns about transmission within households. That's one of the biggest areas of concern. It seems that that's exactly what has now happened with these latest cases. Can you let us into how that's playing into your thinking about recommending to the Premier that the restrictions on household gatherings be lifted or not, and when do you think we'll be ready to go down that path?
I suppose the reason we've described the risk associated with households is that throughout the pandemic we've sort of identified what are those high-risk venues, and that's why I think it's important that the public realises that those venues indoors, in households, are often the highest risk. So that clearly played into our advice about limiting household gatherings, given that risk, and the fact that people will tend to let their guard down. There's not that structure. But we also know other settings such as hospitality, we know the singing and dancing, so all of those things that we've described that pose a risk of transmission, we've learnt through the COVID response. And of course, those understandings feed into our advice to government about the risk thresholds. So obviously when we're more comfortable that we've totally got rid of community transmission, we can start looking at easing those restrictions and those levels. But again, we can do things perhaps in other settings outdoors that are very different to what we allow indoors. And so there's differentials advice about singing. So clearly that knowledge of how COVID transmits, what settings are at greater risk, feed into our advice. And I know sometimes that is hard for people to understand why there are differences, but it is because we've learnt so much about how COVID is spread, and there is big differentials between outdoor and indoor settings, and we know that households are particularly at risk.
So just picking you up on that, there's no suggestion then that the restriction on having 5 people in your household, 5 guests in your household, is going to be lifted until we have zero community transmission? No,
just to clarify, that obviously as we get more confidence that we have approached no community transmission, that's a time when we consider easing of restrictions, and we will do so. And I think that the Premier and the Minister flagged that obviously we understand the impost of household gathering sizes on people's lives and families, and obviously we will turn our mind to that, and that's one of the key controls that were put in place because of the risk of household gatherings, and obviously we will formulate our advice depending on the circumstances. I would actually say that it will make it a lot easier for us to understand what's going on if we get those testing rates. So can I just have a call out to you? Please, anyone in your household that's got a cough or cold, fever, headache, loss of taste and smell, please just get tested. Don't say, oh, I'll just wait another day, or I'll take some Panadol and it might get better. Please go and get tested. That assurance that we have found every last single case of community transmission will really reassure us. There's always a lingering doubt that we've missed cases, but I think this highlights the actions of these individuals in coming forward for testing has stopped a potential chain of transmission. If these were not picked up now, then in 2 weeks' time we could have been having a very different discussion and different impact. So can I again thank this grouping for their cooperation with the investigations, but also for turning up for testing.
Sorry, Premier, could I just ask you, what we're seeing with the Australian Open, how concerned are you by that and by what we're seeing there?
They're matters obviously for the Victorian government to manage. I think what people of Australia want is consistency. I think people in New South Wales want to go home to Victoria. I think people want to know that their freedoms are being considered in view of what's happening with that, and I think there's an issue with consistency that's a cause for concern.
And why people would be upset that they can't go back to Victoria when...
I've always said I can't understand why the border was closed in the first place and why the attitude of certain governments is what it is, especially given the federal authorities have not deemed any particular place in Australia a hotspot. I think the Federal Minister today confirmed that. There isn't anywhere in Australia that's currently being designated as a hotspot, so why shouldn't people be able to return home, and why shouldn't Australians be able to move around freely? I've always been arguing for that, and I think this international event highlights the inconsistency of that.
Yeah, we're hearing reports that Manly, the Corso in particular, was very busy last night, and potentially one hotel where people were lining up to get in without any social distancing guidelines being followed. So who's responsible for a venue if there are crowds gathering outside for ensuring social distancing, and comment on whether or not people are letting their guard down too much, particularly in the northern
Well, look, I don't know about that case that you raised. I haven't heard any reports about that. But obviously, not only do we have regulatory authorities, not only do we have police on the beat to make sure people are complying, but there's also common sense involved. I think now it's been nearly a year since all of us have been dealing with the pandemic. I think all of us know what's safe. I think all of us know what physical or social distancing means. And I just ask people not to let their guard down, especially when they're amongst familiar people, their family or their friends, or they're socialising. We want to make sure we continue to give people the utmost freedom in New South Wales in a COVID-safe way, and we don't want to have to go backwards at all. So I just appeal to everybody, please come forward and get tested. Those high rates of testing will allow us to ease restrictions, but also please respect the existing rules, because the more people that do, the safer we'll be, and the more opportunity we have to live a normal existence as possible during COVID.
Last one, thanks. Okay, thanks everyone.
Okay, cool. Thanks everybody.